The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Hi, good day. I'm Dr. Rubio. I will be your lecturer for your first lecture in Biochemistry. So, let's start now with General Chemistry muna tayo. So in Gen Chem, let's have some review of concepts here. Sunlight coming from the sun is perceived by the eyes and information is then transmitted by the visual pathway to the occipital lobe. What law of thermodynamics governs this situation? So in this case, meron kang sunlight coming from the sun. This sunlight is acting as a form of electromagnetic radiation, a form of light energy. And eventually, this sunlight, via a process known as signal transduction. Light signal is being converted into a chemico-electrical signal, allowing the information to be transmitted along the visual pathway. Okay, eventually, putting you an information at the back of your head sa ating occipital lobe where the primary visual cortex resides. So nagkaroon ka ng change in the form of energy, but it's neither created nor destroyed. So, di ba, that is the first law of thermodynamics na una mong maalala or matuturo sa'yo back in high school or even in grade school. Hence, the correct answer here is the first law of thermodynamics. Guys, laws of thermodynamics, napaka-questionable and testable concept yan sa PLE natin. You have four laws. Zeroth law, first law, second law, and third law. Okay, so for some refreshers lang bale, the zeroth law occurs or happens wherein if two bodies are in thermal equilibrium with a third body, then they are also in equilibrium. As I've mentioned before in my lecture, always remember your transitive property in mathematics. If A is equals to C and B is equals to C, therefore A is equals to B. Alright? The first law is the first law that you will probably encounter in secondary schooling or even in primary schooling, wherein energy is neither created nor destroyed but only transformed from one form to another. Kaya do kanina, di ba, that is the correct answer, the first law. Kasi sunlight, the light energy, is transformed into a chemico-electrical energy, allowing it to be transmitted in the occipital lobe or rather in the visual pathway going to the occipital lobe. Okay? The second law talks about entropy. Okay, entropy, ano ba yan? Entropy is the parameter that tells us about disorder. Okay, gusto mo magkaroon ng disorder in the universe. Gusto mo maging makalat eventually. Everything governed by the second law, it tells about entropy. Okay? Saying that the universe has a tendency na maging makalat. Magkaroon ng chaos if afterwards. The third law states that the entropy of a system approaches to a constant value when temperature reaches absolute zero. It actually makes sense, diba? When you have a temperature of absolute zero, hindi gumagalaw ang yung mga molecules. Because temperature is actually a function of the movement of your molecules. Kapag hindi gumagalaw ang mga molecules mo, ano ba ang nangyari dito? Wala kang temperature. You are zero. Now, kapag wala kang temperature, hindi ka gumagalaw. Therefore, wala kang disorder. Wala kang entropy na nangyayari. So, as long as you're at that state of zero temperature, meron kang constant na absence of entropy. Having a constant value in this case. Okay? Now, of course, we have to review the different methods of heat transfer. We have conduction, convection, and radiation. Conduction, basically kapag ikaw ay humawak ng isang bagay na mainit, malilipat ang heat mula sa bagay na mainit going to your hand. Okay, that's via direct contact. Pag usapan ay convection, it's all about the movement of fluid, okay, which is air or water. Ang nangyari, the heated fluid is caused to move away from the heat source. Now, convection is related with evaporation. In evaporation, ano ba nangyayari dito? Kapag ikaw ay naiinitan, ang tendency mo ay mag-sweat, mag-perspire. When you perspire, ang nangyayari, the sunlight above you tries to dissolve the water on top of your skin. So, umiinit ang water na yan, eventually it goes up. Ganun kasi nangyayari, guys. If you have a hot gas, ang tendency mo ay to go up. Dahil ikaw ay tumataas, yung mga cold na gas ay bumababa. Therefore, it's actually very effective kasi kapag tumataas ang hot gas mo going to the atmosphere, the cold gas will then go downwards toward your skin, causing what we call evaporative cooling. Okay? Now, in radiation, there is no involvement of matter. No solid, no liquid, no gas molecules involved. Basically, nag-transfer ka ng heat from one source to another, okay, via electromagnetic radiation, also known as light. Now, ang ating light, may spectrum yan. And along its spectrum, meron kong tinatawag na ultraviolet light rays. You have A, B, and C. Now, B and C are actually very important for health. Kaso, ang ating C kasi, hindi siya umaabot sa balat as long as we have the ozone layer. It's being screened by the ozone layer. UVC is being screened by the ozone layer. Now, the A and B, when it reaches our body, A does not have thorough effect in terms of having different mutations, but it can actually accelerate aging. A is for aging. Ang B natin, it causes bad mutations that can lead to cancer eventually. Okay? Next question about general concepts. What thermodynamic process occurs at constant pressure? Now, as I've mentioned before, remember in medicine, always know the definition of your prefixes and suffixes. Ang sabi dito guys, constant pressure. So, constant means ISO. So, lahat yan may ASO. Check. Okay? Pero sabi dito, pressure. So, alin ba dyan ang nagsasabi ni meron kang constant pressure? Now, pressure, for some medical sense, so isipin nyo dyan guys parate, the bar. B-A-R. Actually, bar is one of the units used in pressure. So, isobaric is the correct answer here. So guys, ang ating choric, metric, and volumetric, all of them refers to one type of thermodynamic process. And that is having a constant volume. Okay, so baric is the correct answer here. So we have here these types. Guys, recall this it's a very testable concept. A diabatic process. A means without. Dia, mimili ka lang. Dia, loss or gain. So without loss or gain of energy. That's you refer to an adiabatic process. Isenthalpic, constant enthalpy. Isobaric, constant pressure. Isentropic, constant entropy. Ang isochoric mo, the constant volume, is the same with isometric and isovolumetric. So guys, take note of this concept. Okay? Isothermal, constant temperature. And in a steady state process, all parameters are held constant. Heat, enthalpy, pressure, volume, etc. So guys, if we know na ang choric, metric, at volumetric all refer to the same thing, malamang sa lamang, kahit di mo maalala tong question na to, you may eliminate them already in the question. That's testmanship. Okay? Next question. What is the major mode of heat loss in humans if the environment temperature is higher than the skin temperature? So, ang usapan dito, mas mataas ang environment temperature natin than the skin temperature. So, kung ito ang tao, let's say ang kanyang temperature is only 37. The environment is around 50. So, ano ba nangyari kapag mainit ang ating environment? Ikaw ay pinagpapawisan. Tama? Pag pinagpapawisan ka, you will perspire and eventually the air will go up, as mentioned earlier. That is known as evaporation, leading to evaporative cooling. So, A is the best answer here. So, thermoregulation in humans is mainly conducted by your hypothalamus. That is the major organ involved in controlling body temperature. Now, heat loss can occur via four mechanisms: convection, conduction, radiation, and evaporation. Now, we can divide them depending on the situation. So, if the skin temperature is higher than the environment temperature, ibig sabihin mas mainit ang ating tao than the environment, therefore, the heat will come from the person. And that will occur para magkaroon ka ng heat loss via one, conduction, and two, via radiation. But between the two, according to different books, radiation is the major form of heat loss from man. Okay? Now, kapag naman mas mataas ang temperature ng ating environment, we have two methods: evaporation and convection, as mentioned earlier. But between them, evaporation is the correct answer in this case. Now, a testable concept that may be asked in the PLE: what condition may affect thermoregulation by limiting swept evaporation and eventually heat loss? Humidity. Guys, di ba? Lalo na lately, nung malakas ang ulan, di ba? Bago umulan, parang maalinsangan. That's a humid air or environment. Sobrang humid niya, alam mong mainit, right? Pero hindi ka pinagpapawisan. So, humidity may actually prevent heat loss. Kaya usually, mas mainit pa nga ang pakiramdam mo kapag meron kang high humidity. Yan ang tinatawag na maalinsangan. Now, how about heat gain? Now, heat gain in humans, paano ba ito nangyayari? Now, the major means for having heat gain is via shivering. Shivering, chills, bigla ang giniginaw. Pag nag-chills ka, of course, gumagalaw yung mga muscles mo dyan. Hindi lang basta-basta nanginginig ka. There's actually the contraction of muscles. And when muscles contract, you're actually generating heat in the process. You have two types of shivering: low intensity and high intensity shivering. If kailangan mo ng shivering na acute ang need mo, for example, bigla ka pumunta sa isang environment na malamig. Pumunta ka sa loob ng Hong Kong Disneyland, sa kanilang snow area, for example. Okay? Dahil biglang malamig doon, kailangan mo mag-generate ng heat bigla-bigla. So you have here a mechanism known as short-term or high-intensity shivering. Para mangyari yan, kailangan mo gumamit ng isang fuel of readily available. So between the two, ano ba ang mas available gamitin? The fat stored in the body or the glucose? Of course, it's glucose. Therefore, if you have need of high-intensity, acute, short-term shivering, you use glucose in the process. But for example, pumunta ka sa isang environment like Pilipino ka. Pumunta ka sa temperate countries, pumunta ka sa Canada. Diba? Malamig naman sa Canada pero not too malamig agad, gaya ng galing ka sa labas, mawasok ka sa iyong Hong Kong Disneyland na ice area. So gradually, ikaw ay nagkakaroon ng climatization sa Canada. Dahil hindi ka pa sanay, gumagamit ka ng shivering mechanism. And di naman siya kailangan talaga na kailangan, so it's in low intensity. So because of that, you may use fat as a source of fuel. Pangmatagalan siya kumaga. Now, you can also have here non-shivering thermogenesis. It's actually being used where? usually being used by babies of lower mammals. Now, these babies, hindi pa develop ang kanilang muscles. Their shivering mechanism is too bad at that time. So, ang nangyayari, the excess fat inside their body is being destroyed by thermogenin. This thermogenin will cause the dissolution of their brown adipocytes para mag-release ng energy para magkaroon sila ng non-shivering thermogenesis. And that's all for your thermoregulation in man. Okay, now we go to the structure of amino acids and your proteins. Number 1, which is an amino acid? Okay, so ano bang amino acid natin? Okay guys, dapat alam mo na yan at this point. Okay, so tama ka. It's your proline. Glycine is an achiral smallest side chain as amino acid. Bakit ba? The glycine kasi, we have the carbon at the center. Meron kang OOH here. Meron ka dyang amino group. Now, in all amino acids, you have an extra hydrogen atom here. Now, the problem with glycine, its functional side chain is also a hydrogen atom. Therefore, hindi iba-iba yung kanyang mga constituents, making this an achiral carbon. And dahil H lang ang kanyang side chain, the smallest atom in the periodic table, glycine also has the smallest side chain. Alright? Now, alanine is the one that delivers ammonia, the amino group, from the skeletal muscle going to the liver, while phenylalanine is the amino acid accumulated in phenylketonuria. Okay, next question. What is the parent compound of the amino acid associated with increased risk for cardiovascular disease? So it's actually a two-step question. So in the exam, expect cascading questions, etc. Ano ba ang amino acid having an increased risk for cardiovascular disease? It's actually your homocysteine. So guys, in the question, in the option, tanggal na si homocysteine. So next step dyan, ang tanong, ano ba ang parent compound ni homocysteine? It's actually your methionine. Okay? Mamaya we'll talk about the parent compounds of different amino acids. The structure of heme is derived from this amino acid. This is actually your glycine. So in glycine, you need to have 2 glycine and 2 succinyl-CoA to form 1 pyrrole. And this pyrrole will join other pyrroles to form your protoporphyrin 9. Eventually, the protoporphyrin 9, kapag nadikatan siya ng ferrous iron. Guys, remember, the ferrous iron, dapat, para magkaroon ka ng activated na heme. Since ferrous iron, as mentioned in biochemistry, is the oxygen binding iron in the body. Kailangan Fe2+ or ferrous form siya. Alright? So, amino acid. These are some first in amino acids. As mentioned, proline is an amino acid. Okay? Yung ating mga branch chain amino acid accumulated in MSUD, that is your valine, leucine, and isoleucine. If you have glycine as the one having the smallest side chain, the one having the largest side chain is your tryptophan. Homocysteine, as mentioned, is the one that can cause increased risk for cardiovascular disease. And take note in B9 and B12 deficiency, tumataas ang ating homocysteine. So if you have chronic B9 folic acid or B12 cobalamin deficiency, you can actually increase your risk for having cardiovascular problems. Proline and glycine disrupts the alpha helical formation. So guys, remember this mnemonic. Kapag patay gutom ka, you want to break the line in the cafeteria. Patay gutom, proline, glycine. Okay, so these two amino acids can break the line of your alpha helices of your globular proteins. Carnitine is involved in the transfer of LCFA to the mitochondria for beta oxidation. Remember guys, the main site of beta oxidation of our fatty acids is the mitochondria. Arginine is a semi-essential amino acid, meaning kinakailangan mo lang siya usually in times of increased stress or kapag ikaw ay merong puberty. Okay? Remember guys, you are essential kapag hindi ka nagagawa ng katawan. You are essential in the diet. So, kailangan mo siya makain sa diet para magkaroon ka nun sa iyong katawan. The 21st amino acid, don't forget, is your selenocysteine. And the 22nd amino acid is your pyrrolysine, which is also found in archaea organisms. Archaea organisms is also found inside your human GI tract. They may also influence your metabolism. Okay? So as mentioned, you need to know your derivatives of your amino acids. And of course, the other way around, the parent compounds. So guys, always remember your parent true love does not exist. Okay? Phenylalanine, tyrosine, and oops, L-DOPA. L-DOPA, dopamine, norepinephrine, and epinephrine. Also take note guys, this family line is also the one producing your thyroxine directly from tyrosine and melanin directly from your L-DOPA. Tryptophan becomes your trypmoshano, melatonin, serotonin, and your niacin. Histidine, okay, becomes your histamine, a very important vasodilator. And as mentioned, heme is derived from glycine. GABA and glutathione stems from glutamate or glutamic acid. Glutamic acid is the major neurotransmitter causing excitation in both the brain and the spine. Pag ang usapan naman ay inhibition, kapag brain ang usapan, it's GABA. Pag inhibition naman of the spinal cord, it is your glycine. Arginine becomes your creatine, urea, and nitric oxide eventually. Okay? And of course, we also have your lysine becoming carnitine and methionine becoming your homocysteine and even cysteine. Next question. The demand for this amino acid increases during skeletal growth and maturation in adolescence. Okay? So it means guys, originally, siya ay non-essential. If you're non-essential, kaya siyang gawin ng iyong katawan. Pero in times of adolescence, you have puberty. Okay, you have rapid growth spurt. Gumagawa ka ng mga secondary sex characteristics. This time, nagiging essential ang ating arginine. So, arginine is actually a type of semi-essential amino acid. So, always don't forget, guys, the types of your amino acids. And so far, this is the best mnemonic we have. Okay, always remember guys, private team hall. Okay, these are your essential amino acids. But remember guys, always argues. Okay? And never tires. Sabihin guys, ang A dito is always arginine. But the T's we have here are tryptophan, threonine, but never tyrosine. Because tyrosine is a form of a non-essential amino acid. But take note guys hiniwalay ko si arginine dito kasi it is technically a semi-essential amino acid. So besides puberty guys, tumataas din ang ating arginine kailan? During times of stress and times of surgery. Kasi arginine is actually critical to immune function. So arginine is the amino acid most critical to immune function. Okay? So, more pearls naman in surgical nutrition. Okay? Ang glutamine is also important. Ang glutamine naman natin, siya ang primary source ng nutrition ng ating small intestines. So, kailangan mo siya masama sa diet ng taong may surgical case. Especially those having nil per orem status. Pag ang usapan naman ay source of nutrition for the colon, you must use your short-chain fatty acids. So they're very useful when? Kapag you're trying to increase the motility of the intestines of your patient na matagal nang hindi nagkakaroon ng enteral or oral feeding. Next question. How is the amino acid sequence read? It's very simple. Ano ba ating sequence? Pag binasa mo ang amino acid, ano na unang binabanggit mo? It's the amino. Next, when you read it, acid. Therefore, you read the amino acid sequence from the N terminus, the amino end, to the C terminus, the acid end. Therefore, B is the correct answer here. So, mali ang A natin. Pero, Doc Rubio, ano ba ang 5N to 3N? And 3N and 5N? Probably, it's talking about the order of bases in our nucleotide sequences. But, in terms of them, ang tamang sagot is actually C. You read or write the base sequence of nucleotides from the 5N going to the 3N. What are the bonds involved in the tertiary proteins? Okay. 1, 2, or 3. So guys, I'm leaving this question kasi you may expect L-type questions. Okay? Hindi pa sila nawawala and totally eliminated in board exam questions. You must be prepared here. Yung type of question na to, yung pinakamahirap kasi wala kang testmanship na magagawa dito. Pero isipin mo dito guys, proteins. Siyempre, alam mo dapat na ang major bond mo in the protein connecting one amino acid to another are the peptide bonds. Therefore, tama lahat ng may 1 natin. 1, 1. And ito baka tama rin, di ba? So, more count, mali talaga ang B natin. So, only have A, C, and D in this case. Pag-usapan ng tertiary structure, you're trying to make what? You're trying to make a 3D structure of your proteins. So therefore, of that protein, you want to become 3D in the process, right? Therefore, you must have hydrogen bonds in this case. So tama si 1 and 2. And tama din ang ating 3. Bakit? Kasi those amino acids na takot kay water, they tend to go where? They tend to go inside the core of your protein. So para sila ay mag-interact with each other, you may have hydrophobic interactions. Therefore, if you want to perform or make a tertiary structure or a 3D structure, you must have all 3 of them. Therefore, the correct answer here is D, all of the above. Again guys, the primary bond linking one amino acid to another is your peptide bond. If you form secondary structures, we can be alpha helices and even beta plated sheets, you must have, of course, a peptide bond and an additional hydrogen bonding. Now, kapag bubuo ka na ng tertiary and quaternary structure, you must now have the complete football team. Peptide bond, hydrogen bond, disulfide bonding, hydrophobic interactions, and ionic interactions. Now, among all of them, kapag nagkaroon ka ng denaturation, for example, you add high amounts of heat, you add alcohol, etc. sa isang protein sample, lahat ng ating structures masisira. Tanggal si tertiary quaternary, tanggal si secondary, except si primary structure. Okay, siya lang ang ating mareretain dito. Therefore, what bond is preserved when a protein sample underwent denaturation? The correct answer would be peptide bonds. Since the primary structure is preserved, and you know that the peptide bonds are the ones linking one amino acid to another. 20-year-old patient having a kinky hair. What is the micronutrient deficiency of this patient? So guys, you have to take note of the different parameters in clinical manifestation. In the exam, it's all about not only testmanship but also pattern recognition. Okay? So sabi niya kinky hair. Ano kaya yun? So kinky hair is always copper. Kinky or steady hair. Okay, so you should have testmanship, pattern recognition, you should have buzzwords. Kinky hair, always think of your copper. Okay, pareho lang yan, your steely hair. Pag corkscrew hair ka na, that is your ascorbic acid or vitamin C. Ay, tama, vitamin C. Okay? Next. Okay, so we have your collagen fiber. Pag ang usapan is always tensile strength. That's a keyword. Tensile strength. Always think of your collagen fiber in the process. Now, always remember the substances involved in collagen synthesis. Pag ang usapan ay hydroxylation step, you must always have ascorbic acid, vitamin C, ferrous iron, always in the form of Fe2+, oxygen, and alpha ketoglutarate. Pag cross-linking step naman, you must always have copper in the process because copper is important in activating the enzyme causing the cross-linking of your collagen fibers. Now, let's talk about here the defects involved in collagen fiber synthesis. Pag ang problema ay triple helix formation, it can lead to osteogenesis imperfecta. Ito yung having brittle bones, and having blue sclerae. Blue ang sclera ng mata nila. You can also have scurvy if you have the problem in hydroxylation step. Kasi scurvy is caused by the deficiency of vitamin C. And vitamin C is actually an important compound in the hydroxylation step of collagen synthesis. And of course, if you have Menkes disease causing copper deficiency, you will have a defect in the cross-linking of your collagen fibers. Next question. What is the type of collagen seen in anchoring fibrils? Anchoring fibrils. Anchoring fibrils, these are actually structures that actually anchor the epithelium to its basement membrane. So meron ka dyan mga anchor. Anchor, it anchors the epithelium to the basement membrane. So para siyang hook dito. As you can see, the hook here is shaped like number 7. So that's the mnemonic here. Anchoring fibrils are your type 7 collagen fibers. So we have here the major types of collagen fibers. Again guys, huwag kalimutan to parate. Bone for type 1. B1, bone type 1. Cartilage type 2. Your type 3 collagen is also known as your retriculin fibers. 4 on the floor, type 4. And 7 look like hooks. Now for some pearls, remember guys, bone ang usapan, therefore, osteogenesis imperfecta is associated if you have a problem in type 1 collagen. Pag cartilage ang usapan, of course, may problema ka sa cartilage, such as achondrogenesis. Chondro means cartilage. Retriculin fibers. It's a problem mainly of your vascular type, EDS. You have different types of EDS and one of them is vascular type. If you have that, ang problema mo is mainly you have a higher risk for having aneurysms. You can have a higher risk for having aortic dissection. Now, besides these pathologies, take note that retriculin fibers is the first type of fiber occurring in early wound healing. Eventually, as wound healing develops and progresses, yung iyong type 3, napapalitan na ng ating type 1 collagen. Therefore, in later wound healing, predominant ang ating type 1 collagen fibers. Type 4 is associated with 2 prominent syndromes. Alport syndrome and Goodpasture syndrome. Alport syndrome is usually hereditary in nature. You have here hematuria, usually occurring after a previous infection. You also have hearing loss and you have ocular problems. In Goodpasture syndrome, ang problema niyan, you have 2 manifestations na may bleeding. You have hemoptysis and hematuria. Sumusuka ka ng at sumusuka, umubo ka ng dugo. While hematuria, umiihi ka ng dugo kasi meron kang problema sa basement membrane ng iyong lungs saka ng iyong kidneys. And of course, we have your dystrophic epidermolysis bullosa. Involved dyan ang ating anchoring fibrils. They look like hooks in the process. Now, we have here a 45-year-old female with long upper extremities and a superotemporal ectopia lentis, meaning yung kanyang lens ay na-dislocate going superior and temporal ang direction nila. Okay, and at the emergency department, meron siyang pulsating abdominal mass. So what is the most likely diagnosis of the patient? So, having a pulsating abdominal mass, ano kaya ang sakit na to? Yun ang unang mga isipin dito. So with that said, mukhang meron siyang abdominal aneurysm. And these are the conditions having a high risk for aortic aneurysms and eventually aortic dissection. We have here Marfan syndrome, Ehlers-Danlos syndrome, and Loeys-Dietz syndrome. So for the others, Doc, ano ba yung Loeys-Dietz syndrome na yan? Now, your Loeys-Dietz syndrome, okay, it's also a form of connective tissue disorder mainly because of a problem of a transforming growth factor. Now, ang kanyang presentation, besides having your risk for aneurysm, you also have here a bifid uvula. It's actually pathognomonic for LDS or Loeys-Dietz syndrome. Now, given the case, so yan ang ating so mukhang malabon na ikaw ay homocystinuria. And on top of it, take note na ang direction ng iyong ectopia lentis or lens dislocation is superotemporal. Okay, so mukha siyang kamay ng ating Marfan syndrome patient having long, lanky upper extremities. Therefore, the correct answer here is actually Marfan syndrome. Okay? Now, pag-uusapan naman elastin fibers, always think about of elasticity. Elasticity means deformable. Para ang rubber band. Pag hinila mo siya, it will go back to its original state. That is elasticity. Pag-usapan ay tensile strength, always think of your collagen fibers. Pero pag elasticity, it's elastin fibers. Now, as mentioned, we have your Marfan syndrome. Ang problema sa kanya nga lang, hindi ang ating elastin fiber. It is the fibrillin. The fibrillin is the scaffold protein used in elastin fiber synthesis. Ang fibrillin mo, siya ang ating template. For example, meron ka dyan template, that is your fibrillin. Tapos dyan tumutubo ang ating elastin fiber. Okay. For simpler mechanism, think of a grape vineyard. Okay. So for example, meron ka diyang parang mga fences. That is your scaffold. Yan ang iyong fibrillin. Yung vines mo na tumutubo around it, yun ang ating elastin fiber. Okay? As mentioned guys, iba ang lens displacement ng ating Marfan syndrome at ng yung homocystinuria. Pag Marfan, it is upward-outward, superotemporal, while ang ating homocystinuria is downward-inward, inferonasal. So remember guys, think of a Marfan syndrome patient na nakataas ang kanyang upper extremities upward and outward. What is the most abundant immunoglobulin in the body? The correct answer is no other than, IgG ba sagot mo? No, mali yan, okay? The correct answer should be IgA. Pag ang usapan ay serum, that is your IgG. IgG is the most common antibody in the serum. Pero pag ang usapan ay in the body, meaning overall na, body ang usapan IgA ang tamang sagot dyan. Let's have a review of the structure of your immunoglobulins, also known as antibodies. So kapag ang usapan ay antigen-antibody complex formation, also known as immune complex formation, you have two important structures, the epitope and the paratope. As you can see the image in the right side of your screen, So this is your antigen, this is your antibody. The part of the antigen participating in the immune complex formation is known as an epitope. So this is the epitope. Alright? Now the part of the antibody participating in the immune complex formation, that is your paratope. Okay? Yung may E sa pangalan, antigen, that is epitope. Yung wala, that is your paratope. Now, other concepts in immunoglobulins, remember that your antibodies can be divided into different fragments. Okay, so you have here your Fab fragment. Okay, you can have two depending sa morphology. Pwedeng isa lang sila kapag ang nyati mo ay only this part. If you make hate, okay, bigyan ng konyo, make hate the immunoglobulin into one Fab component in the Fc region, okay, kailangan mo ng pepsin. Okay, kasi you may destroy the immunoglobulin into two parts. Since pepsin has two syllables. Pero pag ang gusto mo ay tatlong parts ang mabubuo mo from one immunoglobulin, you need to have papain. Papain, papain. Okay? Papain. So 1, 2, 3. Hinahati mo yung immunoglobulin mo into one Fc fragment and two Fab fragments. Now, Doc, ano ba yung Fc na yan tsaka Fab na yan? So actually, Fc means crystallizable. And more than that, it is also the functional part of your immunoglobulin. While AB stands for antigen binding. Meaning, yan yung part ng ating immunoglobulin na nagbabind sa ating antigen. To be specific, sa epitope part ng ating antigen. So you have different immunoglobulins in the body. You have 5. IgG, IgA, IgM, IgD, and IgE. So, kapag ang usapan ay complement activation, it's always your IgG and IgM. Kapag ang usapan ay antibody capable of passing the placenta, it's your IgG. So, always take note of that concept. Ang tanging nakakadaan sa placenta is IgG. So for example, if I am suspecting a neonatal infection, meaning may infection ang isang bagong silang na bata. Okay, malamang sa malamang galing ang kanyang infection kay mommy, right? So if I want to test kung meron ba siyang sakit, the best antibody to test is not IgG. Bakit? Kasi if I would test for IgG, baka falsely positive na meron siyang infection. Kasi most likely, the IgG positive sa baby ay galing sa kanyang mommy, kung saan ang galing ang infection. Therefore, the best antibody to test is an IgM test. Kasi it will make sense dahil ang IgM does not pass through the placenta and is a reflection of the primary immune response of the baby. Okay, remember guys, kasi in a primary immune response, ito yung first interaction ng katawan mo to a foreign body or to a microbe. So usually, it's a very slow and very small response. Mainly concerned by IgM. Pero, in the subsequent exposures known as secondary immune response, it is now faster and higher in strength and mainly mediated by IgG antibodies. Okay? IgM primary immune response, IgG secondary immune response. Now, kapag ang usapan naman ay IgE, it's mainly because of helminth infection and mast cell activation. Doon mas sila kailangang malaman. While naive B cells, okay, they contain IgM and IgD on their surface. Now, some added bonus, IgD is also implicated for immunomodulation. IgD for immunomodulation. Okay, can be asked in the PLE. Okay, we're done with proteins and amino acids. Now we head to your structure of your carbohydrates. So, question number 1, what is the chief constituent of the exoskeleton of the insects? Guys, Kailangan alam yan. That's very basic. Okay? It's your chitin. Chitin is also the chief constituent of the exoskeleton of your crustaceans. Kamag-anak yan ng mga insects. And chitin is found in the cell wall of what? Of fungal organisms. Inulin, that is the reference material used in the estimation of your glomerular filtration rate. Moreover, inulin is actually a polysaccharide of what monosaccharide? It's a polysaccharide of fructose. Starch and glycogen are storage polysaccharides. They're the ones that store energy to be used by an organism. Ang starch nga lang is for plants while glycogen is for animals. So, carbohydrates is the most common organic molecule in nature. In contrast to your proteins. Proteins kasi is the most common organic molecule in the body. Okay, pag ang usapan ay body, ang pinakamarami ay proteins natin. So, the most abundant protein in the body, to be specific, is collagen fiber. Mainly type 1 collagen fiber. Na pag ang usapan naman guys ay plant cell walls, cellulose ang ating component dito. So, remember guys, starch ang ating storage polysaccharide. Pero pag constituent ng plant cell wall, it is always your cellulose. The universal fetus fuel is glucose and the predominant sugar of the body. Pero, kapag fuel naman ng sperm, it's fructose. Okay guys, remember that ha? Kapag fuel ng baby na nagawa na, it's glucose na. Pero kapag ang baby ay sperm pa lang, okay, the fuel of the sperm, it's actually your fructose. And recall it guys, remember this, okay? L-amino acids are more common in the human body. But the sugars are the most common or the more common configuration of sugars in the body. Okay? So what is the linkage of the branching points of glycogen and starch structures? So ang ating kasi mga glycogen and starch structures, they're storage polysaccharides. They're made up of super dami na sugar units and they tend to branch out eventually. When they form a straight line, you have an alpha-1 for linkage. But pag sila ay nag-branch out from one line, branching out eventually, they need to have an alpha-1,6 linkage. Okay? So as mentioned, glycogen is the storage polysaccharide of animals. So in its linear part, as you can see here, ang tawag dyan ay alpha 1 to 4 linkage. Pero pag siya ay nagkaroon ng sideway na branching point, ang tawag dyan ay nagkakaroon ka ng alpha 1 to 6 na linkage. Okay, that's the linkage at branching points. Now, starch is the major polysaccharide of plants for storage. Meron siyang dalawang major components. Meron siyang amylose saka amylopectin. Ang amylose mo, siya ay mainly unbranched, meaning straight lang siya na configuration. Therefore, if it's only straight, it only have alpha-1 for linkages. In contrast to the amylopectin na mas madami, in contrast to amylose, siya ay branch and insoluble. Therefore, meron kang both alpha, 1 for linkages for the straight lines, and you have an alpha-1,6 linkage for the branching points of the starch. Now, among the choices, which cell or tissue predominantly has GLUT5 transporters? Again guys, remember, ano bang GLUT5 natin? GLUT5 is mainly for fructose. Fructose. So ano ba ang ating cell or tissue here that requires fructose mainly? Remember guys, kapag baby na siya, you are requiring glucose. Pero pag sperm pa lang ang baby, mas fructose ang kanyang kailangan. Therefore, sperm is the correct answer here. So these are your glucose transporters. Okay, you have two major mechanisms. One, facilitated diffusion, and 2, secondary active transport. Among all of them, only SGLT1 and 2 are secondary active transporters. The rest are facilitated diffusion. Now, we have here many mnemonics, kumbaga. Okay, GLUT5 is mainly for the fructose. Okay, bakit? Okay, fructose it's actually found in 2 areas. The sperm, kasi sperm ay kailangan ng fructose. And of course, the GI tract, para maka-absorb ka ng fructose from the intestines going to the body. Now, GLUT4 is very special kasi it's the only one that is insulin dependent. Meaning, hindi siya gagana unless meron kang insulin in the blood. It is only utilized by 2 tissues: striated muscles and adipose tissue. Striated muscles are skeletal and cardiac muscle. Therefore, hindi striated ang ating mga smooth muscles. GLUT4 are always insulin dependent. Now, GLUT2, always think of number 2 or something in the second place. Okay, beta cells, diba? It is the second letter in the Greek alphabet. Kidneys, you have 2 kidneys. Liver, you have 2 major lobes, the left lobe and the right lobe. And the GI tract, GI has 2 letters. Okay? Now, the next question will tackle about the location of these transporters. So, what glucose transporter allows movement of all monosaccharides across the basolateral membrane? Okay? It's actually your GLUT2 transporter. So, the uptake of monosaccharides, okay, mainly nangyayari siya at the level of your enterocytes. But the only type of carbohydrate that can be absorbed by your enterocytes, dapat naka-monosaccharide form ka. It cannot uptake disaccharides and even, of course, polysaccharides. So, as you can see here, GLUT5 and SGLT1 are both at the brush border area. This is actually the apical area. And the apical area is the one beside the lumen, sa butas ng ating GI tract. Okay? Now, this is the basolateral membrane. Ito yung part ng ating enterocyte na katabi ang ating mga capillaries. Ayos? Now, as you can see here, guys, SGLT1 only absorbs glucose or galactose. So, balang fructose, kailangan ng GLUT5 dito. And take note, guys, that GLUT5 is found near the lumen. Remember, lumen has 5 letters. Now, kapag nakapasok na ang ating glucose, galactose, or fructose sa ating cell, hindi pa nag-stop dyan ang ating absorption. Kailangan pa niyang dumaan across the basolateral membrane. And with that, you have here the major transporter known as GLUT2. GLUT2 is found at the basement membrane. Remember, guys, basement membrane has 2 words. So, GLUT2, basement membrane. It carry overs glucose, galactose, and fructose in the process. Structure of lipids. Okay, so for question number 1, what type of protein has the highest protein content? So, alin ba sa mga yan yung may mas mataas na protein content? So, syempre, kung isipin mo, ang ating type of protein kasi ay balanse ng lipid sa protein. If mas mataas ang ating protina, meaning mas konti ang iyong lipid in the structure, tama? So, alin ba dyan yung pwedeng pinaka maganda sa katawan natin? If mataas siya. And that is your HDL. Kasi HDL is mostly protein than lipid. Kaya it is the lipoprotein having the highest protein content. Okay? So, pearls about lipids. Most storage form of lipids in the body, it's N-triacylglycerol. Okay, that's the most common storage form. The lipoprotein with the highest TG content or triglyceride content is your chylomicron. It also has the largest diameter and lowest density. Bakit siya lowest density? Kasi chylomicron is mainly fat. Okay? And this chylomicron na sobrang laki, it can actually float in water. So, in patients with steatorrhea, mapapansin mo, lumulutang ang taba sa kanilang pupu. Okay, those are mainly your different triglyceride contents, mainly found in chylomicrons. LDL, that is the bad cholesterol. Therefore, it's the one having the highest cholesterol content. While HDL, the good cholesterol, syempre mas konti yung kanyang cholesterol, kaya nga siya good eh. So mas mahaba, mas mataas ang kanyang protein content. And take note that the major elimination site of cholesterol is always biliary excretion. So you have here an 80-year-old male, kakiktik patient. Sobrang payat ng pasyente natin. He was admitted for severe malnutrition. So ang rule and thumb, if you have a severe malnutrition, huwag siya pakainin agad. Bakit? Kasi you want to prevent what we call refeeding syndrome. If you give a malnourished patient large amounts of food, ang mangyayari, magkakaroon ka ng abrupt increase in insulin. And that increase in insulin can lead to multiple problems, mainly electrolyte abnormalities. And can lead to low potassium, low calcium, low magnesium, and even low phosphorus. So, iniwasan mo ang refeeding syndrome natin. So, dapat mag-start ka muna sa isang low caloric feeding to prevent the refeeding syndrome. Now, because malnourished yung pasyente mo at di ka makakain masyado, malamang sa malamang pangit ang iyong absorption ng iyong mga nutrients. So, you want to start on a low caloric trophic feeding. Trophic meaning you want to increase the size, okay, and you want to stimulate hyperplasia of your intestinal enterocytes. So, you plan to improve the colonic function, the colon of the patient. So, what type of fatty acid is beneficial if you want to improve the colon of your patient? It is your short-chain fatty acids. So guys, pinag-usapan na namin to ni na Broly, Ron Baticolon. Follow these size parameters. Okay, short-chain is C2 to C6N size, MCFA C18 to C14, long-chain fatty acids is at least C16, and VLCFA is at least C22. Bakit? Okay, these two are the most consistent. Itong nasa gitna, paiba-iba yan depending on studies. But so far, this cutoff values is the most consistent pa rin. Now, remember guys, are fatty acids. Ang yung mga fatty acids kasi, meron siyang mahabang chain. The only part na hydrophilic sa kanya is the carboxyl and the rest is actually hydrophobic. So it means habang umahaba ang iyong fatty acid chain, mas lalo siya nagiging hydrophobic. Therefore, if you have long fatty acids, hindi mo siya kayang ma-absorb directly into the portal vein. So kailangan siya ma-transfer via your chylomicrons. Klaro? Now, in contrast to your medium chain fatty acids and short chain fatty acids, hindi sobrang haba nung kanilang hydrocarbon chain. Medyo maiksi lang siya ng konti. Therefore, it is relatively hydrophilic. It can actually be absorbed directly into the bloodstream going to your hepatic portal vein. Next question. This fatty acid is associated with the development of fetal brain and retina. Guys, nakakanood ka ba ng TV? Okay, baka hindi na, baka meron TikTok na siguro or YouTube, whatever, FB stories, di ba? If you recall ng bata pa kayo, you always hear of DHA. DHA, bentang-benta yan sa ating mga formula milk kasi they can actually be associated with improvement of the fetal brain and retina. Now, fatty acids can also be essential. We have two pure essential fatty acids, linoleic acid and alpha-linolenic acid. Now, one of them is actually the parent compound for your arachidonic acid. Arachidonic acid is a very important mediator kasi it's being used to make different inflammatory mediators. Mga prostaglandins, prostacyclins, thromboxanes, and even leukotrienes and lipoxins. Okay? This arachidonic acid is derived from the linoleic acid. Kaya siya isang form of semi-essential fatty acid. Now, kailangan mong malaman dyan is that linolenic acid, the one with N, is not the parent compound of your arachidonic acid. It's usually a source of confusion. Okay? Now, omega fatty acids. So, your fatty acids can be actually classified then in terms of their omega numbering as described in my lecture before. So, medyo kailangan mo rin malaman ito ng konti. And as you can see, omega-3, we have your alpha-linolenic acid. Tropa niya dyan si timnodonic acid and your DHA, also known as hervonic acid. Dahil nga tatay ni arachidonic acid, si linoleic acid, sila din ay magkapamilya. Also part of omega-6 series. And lastly, we have your omega-9, we have your elaidic acid and oleic acid. Now, structure of nucleotides. So what high energy bond exists between the phosphate atoms of adenosine triphosphate? So sige, let's first visualize our adenosine triphosphate. Diba? It's an ATP. So the A here, and we have here one phosphate, one more phosphate, and another phosphate. So ang tulong niya is not this bond, but a bond between two phosphate atoms. Okay? So actually, the correct answer here would be an anhydride bond. Okay? Kaya maganda ang ating ATP. Kasi ang ATP mo, a very good source of energy siya kasi meron siyang dalawang anhydride bonds here. In contrast to the ester bond occurring between a phosphate molecule and adenosine. So recall the nucleotide. A nucleotide contains a base, a sugar, and a phosphate. Kapag meron ka lang ay base and sugar, ang tawag sa kanya ay nucleoside. Okay? S for sugar only but walang phosphate. Now, let's talk about the bonding. Ang bond between sa iyong base saka sa iyong sugar, ang tawag dyan ay N-glycosidic bonding. Ang tawag sa bond na nabubuo between the sugar and your first phosphate molecule, ester bond. Now, ang tawag sa bonds between two phosphate molecules, ang tawag dyan ay anhydride bonding. So, let's have a quick review of your macromolecules. Okay, now, the mentioned macromolecules, okay, amino acids are the monomers. They are the single units. Ang kanyang bonds ay peptide bonds. Ang polymer ay protein. Monosaccharides, the bonds are glycosidic bonds. Ang polymer ay polysaccharides. Now, ang ating monomers sa ating nucleic acids, they're actually your nucleotides. And these nucleotides form bonds with each other, forming a 3,5 phosphodiester bond, eventually making a nucleic acid, which can either be a deoxynucleic acid or DNA, or a ribonucleic acid or RNA. Now, how about their lipids? Lipids are actually not true polymers. They only share the property of being hydrophobic. Meaning, lahat sila ay takot sa water. Yun lang ang point ng kanilang classification. There are no monomerization occurring at the class of your lipids. So in terms of DNA as mentioned, ano ba sa kanila ang merong capability na maging present most likely in a physiologic medium, meaning a body fluid in the body? It is your bDNA. So as mentioned, bDNA is found mostly in physiologic fluid, while zDNA is found at the 5 end of chromosomes. So parang Z, kasi Z is found at the end of the English alphabet. aDNA is found in low salt and high humidity conditions. mRNA, RNA, and tRNA are all types of RNA molecules. Now, the only protein coding RNA is your mRNA, the messenger RNA. It makes sense. It's the product of what we call transcription. So, gumagawa ka ng transcript at pinapasa mo to the ribosomes para gumawa ng ating protein for translation. So, mRNA is the messenger. Therefore, it is the only protein coding RNA. And therefore, dahil of course, iba-iba ang message ng ating nucleus to your ribosome, siya rin ang ating pinaka-heterogeneous na RNA. But the most abundant RNA in the cell is the ribosomal RNA, the one making up most of the ribosomes. The transfer RNA is the one transferring amino acids to your ribosome para gumawa ka ng isang amino acid sequence. But ang kanyang kakaiba sa kanya is that meron siyang kakaiba na mga bases outside of your usual purine, thymidine, etc. Okay? Now, for nutrition. So, let's first have recall of your dietary reference intakes. It's a general term for a set of values used to plan and to assess the nutrient intakes of healthy people. So, based siya sa ating age group, physiological state, and sex. So, sinasabi niya kung gaano ba dapat karami yung mga nutrients na ating tinitake para tayo ay magkaroon ng healthy na lifestyle and status and away from disease, either deficiency or toxicity. However, these DRIs, it's only meant for normal population but never meant for the sick population. Yun ang kanyang limitation. So, DRIs have 4 major parameters. EAR or estimated average requirement, RDA or recommended dietary allowance, AI or adequate intake, and UL or tolerable upper intake level. So the EAR, ito yung estimate kung gaano karami ang tao na magkakaroon ng 50% na healthy status if tinake mo ang ganitong karaming nutrient. So, sakto lang siya. Okay? Pero syempre, mas maganda ang ating RDA. Kasi ang RDA natin kasi, sinasabi niya na kapag kumain ka ng ganitong karaming nutrient, most likely, nearly all individuals will have a good healthy status. Okay? So, ang RDA, para makuha siya, kailangan mong makuha ang EAR plus the 2 times the standard deviation of your EAR. So, yun ang ginagamit mo para makuha si RDA. It's derived from your estimated average requirement. So, if ikaw ay isang tao na kakain ng isang pagkain, anong gusto mo? Dapat mas mataas ang iyong intake above the recommended dietary allowance per micronutrient found in the food. Kasi gusto mo magkaroon ng assurance na hindi ka magkakaroon ng deficiency. Okay, so you will have adequate intake if you have more than the RDA per micronutrient. AI or adequate intake. Now, EAR or RDA are derived via scientific mechanisms. Okay? But sometimes the scientific evidence is not present when you get it from the micronutrient. So, minsan, you set an arbitrary level kung saan most likely hindi ka magkakaroon ng deficiency. And ginagamit lang siya kapag wala kang EAR and RDA. And that is your adequate intake level. Now, your UL, TUL, or your tolerable upper intake level, kapag lumabas ka sa value na yan, automatically, will have a high risk for having toxicity problems. So, dapat hindi sobra-sobra para hindi ka magkaroon ng adverse events. Example, ang upper limit mo ng vitamin A is 3,000 micrograms. Kapag tumaas ka ng more than 3,000 micrograms, magkakaroon ka ng risk for many adverse events. Now, acknowledging these concepts, so what level of micronutrient intake is considered adequate and has no risk for adverse events? So, dapat ikaw ay intake between the RDA The one saying na kapag more than ka ng RDA mo, nearly 99% ng population hindi magkakasakit. Pero dapat hindi ka lalampas ng ating upper level intake. So dapat nasa gitna ka lang ng RDA and UL. As you can see guys, kapag less than ka ng RDA mo, and most especially, mas pababa pa sa ER mo, ang mangyayari, kulang. Magkakaroon ka ng deficiency. Pero pag mas mataas ka sa RDA or mas mataas ka sa iyong adequate intake, ikaw ay magkakaroon ng adequate na nutrition. Pero pag lampas ka ng upper limit, ikaw ay magkakaroon na ng toxicity problem. So dapat nasa gitna ka lang ng RDA and upper limit. Kung wala kang RDA, dapat nasa gitna ka ng upper limit at ng iyong adequate intake. Klaro? So how much kilojoule is found in 1 kilocalorie of protein? It is always 4.2 kilojoules. Dok talaga, what if kilojoule of, let's say, carbohydrate? It is still 4.2 kilojoules. Dok, how about fat? It's still 4.2 kilojoules. Kasi 1 kilocalorie is always equal to 4.2 kilojoules. Iba-iba lang yung ating derivation of kilocalorie per gram of your macromolecule. As you can see guys, don't forget this lagi itong lumalabas. Carbs and protein are always 4 kilocalories per gram. Ang fat ng very very big, malaki, is always 9 kilograms per gram. And don't forget alcohol. Alcohol is always 7 kilocalories per gram. Okay, your acceptable macronutrient distribution range is very important. Okay, it's a very testable concept. So, ano ba ang AMDR ng carbohydrates in a balanced diet? The correct answer here is 45 to 65%. So, don't forget these ranges for carbs, protein, and fats. And even this table found in your handout. Okay, you have to know this kasi it's a testable concept. Kasi it is actually the balancing of your different foods, nutrients, para magkaroon ka ng well-balanced diet. This dietary protein quality assessment is defined as the ratio of the amount of nitrogen used in tissue formation and the amount of nitrogen ingested. So sabi dito, it's the ratio daw. Ratio ang tanong dito. So kung ratio ka, yung denominator here is the nitrogen used in tissue formation over the nitrogen na iyong kinakain. So ano ba yan dito? It's actually your net protein utilization. Kasi iba ang ating absorb. Pag absorb yan, siya ay ang ating tinatawag na biological value. Guys, iba ang absorb sa ating ingested. Ingested, nanunok mo ang mismong nitrogen content. Ang absorb ay inabsorb ng iyong katawan. Ang tanong ko, lahat ba ng nitrogen ay na-absorb? Hindi. Yung iba kasi ay pwedeng madala sa ating pupu pag tayo ay tumae. Therefore, iba ang ating ingested sa ating absorbed na nitrogen. Okay? Kapag ang ating denominator ay ingested, it is net protein utilization. Pero pag ang ating denominator ay absorbed, it is biological value. So here's a very good slide summarizing your dietary protein quality measures. So all of them are being used to assess the quality of your proteins. Take note guys, ang ating PDCAAS, BV, and NPU all have a value of 0 to 1. 1 having the highest value, 0 being having the lowest value. Kakaiba dyan ng ating PER or protein efficiency ratio kasi it is actually being used to determine the efficiency of animal growth sa mga rats natin. And the value is different. It's 2.7 cutoff. Pag ikaw ay meron 2.7 na value, pataas, you will be designated as having an excellent protein source. Now, breastfeeding is often overlooked in nutrition. And take note of this first, guys, Colostrum is always formed at the 12 to 6 week of pregnancy. Very, very testable. While mature milk develops 4 to 6 weeks postpartum. Guys, always remember, vitamin K is absent in breast milk. And vitamin D is in very, very low levels. Okay? Actually, in some countries, di ba, in the Philippines, we only give vitamin K. But in other countries, we give vitamin D kasi they are also relatively low in amounts. Now, dahil bumaba yung vitamin K, you give intramuscular vitamin K supplementation. Okay, it's very important kasi your vitamin K kasi is one, deficient in breast milk. Pangalawa, it's mainly made by microbes inside the intestine. And kaya siya important kasi nga ang mga neonates wala pa yung microbes sa katawan. Sa GI tract, wala pang gagawa ng vitamin K para sa kanilang katawan. Therefore, sila yung maasa sa exogenous source. And lastly, remember that vitamin K is a fat-soluble vitamin. Ang mga neonates, ang mga bata is around 85% water. So you have a very, very low fat content. Therefore, you have to supplement vitamin K to neonates. And take note of her different breastfeeding hormones. Estrogen, keyword, ductal development. Progesterone, always lobular development. Prolactin, lactogenesis. And of course, oxytocin, the one causing expulsion of milk from the sinuses going to the nipple outward. Now, let's first talk about vitamins before going to your minerals. Remember guys, your endogenously synthesized vitamins. Vitamin D, K, biotin, pantothenic acid, and niacin. Your K, biotin, and pantothenic acid all come from your microflora, mainly inside your intestinal microflora. Vitamin D is derived from 7-dehydrocholesterol. Okay, it's being activated after ultraviolet B radiation comes into contact to your 7-dehydrocholesterol. Now, niacin can actually be derived from tryptophan. Okay, so it's also a very important na concept. However, tryptophan to niacin requires large transmutation. Kailangan mo ng 60 units of tryptophan to make 1 unit of niacin. And on top of that, kailangan mo ng vitamin B6 saka vitamin B2 para gumana to. Among the two, mas kailangan ng vitamin B6 para gumana ang transversion or conversion ng tryptophan to niacin. Now, your water vitamins or water-soluble vitamins, vitamin B complex and vitamin C, almost all of them are found in aqueous medium except for B9 and B12 for storage. Kasi your fat-soluble vitamins, their main storage site is the liver, besides the adipose tissues. And B9 and B12 are also stored in the liver. So kakaiba siya in contrast to the other water-soluble vitamins. Okay, but recall guys that the major site of vitamin A storage in the liver are your stellate cells of Ito. Soluble vitamins. So vitamin A, toxicity. Usually you have a pseudotumor cerebri pag acute ang ating intoxication. Pero pag chronic na, you most likely you have hip fracture and teratogenicity. Deficiency guys, we have a very famous seraphthalmia. Okay, ang seraphthalmia, it contains the constellation of signs and symptoms that are ocular in nature, all related with vitamin A deficiency. Earliest sign, loss of green light sensitivity. Earliest symptom, nyctalopia. We also have here the very famous spots, muted spots. Okay? Recall that vitamin A is important for preserving the ciliated columnar cells of our respiratory tract and the columnar cells of our GI tract. So pag nawala ang vitamin A mo, nagkakaroon ka ng tinatawag na squamous metaplasia. And remember, ano ba ang kailangan para magkaroon ka ng mucociliary tract escalator? You must have vitamin A. You must be in the columnar form. If squamous cell ka, hindi ka magkakaroon ng efficient na mucociliary tract excavator to remove debris and bacteria from the lungs going to the pharynx. So, if you have that metaplasia, dahil sa vitamin E deficiency, you will have a higher risk for infections, and namely, measles infection. Vitamin D in high amounts can lead to metastatic calcification kasi vitamin D increases the absorption of calcium inside the intestine. Moreover, if you have lots amounts of calcium in the blood, remember calcium is important for vasoconstriction and can lead to hypertension. If deficient, you will have rickets and osteomalacia. Depende kung ano ang ating status ng ating mga growth plates sa katawan. Before the closure of the growth plates, you will have rickets. But after the closure for growth plates in the long bones, you will have your osteomalacia. Vitamin E toxicity can lead to platelet aggregation, reduction, but having low vitamin E can lead to problems, mainly involving radicals. Kasi if you have poor vitamin E, recall that vitamin E is a very strong antioxidant. Since meron kang antioxidant, ang ginagawa mo, you are trying to prevent lipid peroxidation of the membranes, the cell membranes. Having deficiency in vitamin E can lead to lipid peroxidation, mainly your RBC membrane. So if sira ang iyong RBC membrane, hindi na ma-maintain ang kanyang bioconcavity. So therefore, kapag dumaan ang RBC mo sa isang very very small na vessel, madali siyang pumutok in the process, leading to hemolytic anemia. So how do you present with hemolytic anemia? You will have a T-colored urine. Kasi syempre, tumatagas ang iyong heme from the RBC na nasira. Right? So ibyan ang isang main difference ng hemolytic anemia from a nutritional anemia, such as iron deficiency and even folic acid and cobalamin deficiency. Kasi dito, meron kang positivity for T-colored urine. And besides that, you also have the demyelination of the posterior columns of your spinal cord. Vitamin K in low amounts can lead to bleeding, diathesis. Okay, so some pearls, guys, the most potent naturally occurring antioxidant is your vitamin E, mainly your alpha tocopherol. Pero hindi lang po vitamin E ang ating antioxidant. We also have your vitamin A, vitamin C, E, zinc, and selenium. Recall, guys, ACE, zinc, selenium. Factors involved with vitamin K include your 2 plus 7 is equals 9 followed by 10. Ako, I memorize it like this kasi medyo nakakita yung 1972. Baka kasi 1 to bigla. But your own preference, guys. So basta 2 plus 7 is equals to 9, it's followed by 10. Okay, and also involve other factors such as protein C and S. And guys, testable concept may be as in IM. Okay? The most prominent side effect of intake of large amounts of vitamin C or ascorbic acid is actually diarrhea. So take note of this concept. Now we have here vitamin B complex. So guys, always remember here the different names, ha? Ang B1 ay, very good, thiamine. B2, riboflavin. B3, nice, niacin, nicotinic acid. B5, pantothenic acid, parang pento. B6 is pyridoxine, and B7 is your biotin. You have to hear their features para sa sila ginagamit. Take note that BT and B3 are always for redox reactions. Okay? If you have large intakes of carbohydrate, kailangan mo ng vitamin B1 kasi it's mainly for decarboxylation. B5 is mainly for coenzyme A component and fatty acid synthase. B6 is always involved in protein metabolism. So if you have large protein intake, kailangan meron kong vitamin B6. Okay? It's for amino acid metabolism. But besides that, it's also involved in glycogenolysis via glycogen phosphorylase. And lastly, we have your biotin, the coenzyme for carboxylation, for metal transfers. Now, deficiencies tayo mag-focus muna. B1 deficiency can lead to two forms. Either dry beriberi, having neuro problems, Wernicke, Korsakoff syndrome. Pag Wernicke ka, it's still reversible. You have your confusion, ophthalmoplegia, and ataxia. But at the onset of confabulation and dementia, you now have your Korsakoff syndrome, which is now irreversible. Pag-usapan naman ay wet beriberi, it tackles your high output heart failure. Kasi if you have thiamine deficiency, ang nangyari dito guys ay nagkakaroon ka ng increase in your SVR. Okay, so this is the cardiac output formula. The MAP is directly related with cardiac output. Okay, but the SVR, the systemic vascular resistance, is inversely related with cardiac output. Pag tumaas ang MAP, tataas din ang ating cardiac output. Pero kapag nagkaroon ka ng decrease in the SVR or resistance due to low thiamine levels, nagkakaroon ka ng increase in cardiac output, leading in high output heart failure. B2, always think of 2 Cs, cheilosis and corneal vascularization. B3, think of 3Ds. B3, 3Ds. Okay, components of pellagra, dermatitis, casal necklace, dementia, and diarrhea. B5, pantothenic acid, all about the paa. Pantothenic acid. You have your Gopalat's burning feet syndrome, a form of nutritional melalgia. B6 is always about your amino acids. Okay? So, of course, amino acids, ano ba yung mga yan? Diba? They make up your neurotransmitters. So, you can have neuro manifestations. You can have seizures, etc. Now, B6 is also involved in allosyntase. So, if ikaw ay may B6 deficiency, pwede ka rin magkaroon ng microcytic hypochromic anemia. Now, as mentioned guys, di ba, kanina sabi ko, tryptophan can become niacin, but it needs large amounts of tryptophan bago ka magkaroon ng niacin. 60:1 ang ratio natin. And kailangan mo ng B6 and B2. But between the two, ano mas mahalaga? It's B6. So, if you have B6 deficiency, pwede ka rin magkaroon ng pellagra-like syndrome. Okay? B7 is all about having dermatitis, enteritis, and alopecia. So, usually nangyayari yan kapag meron kang antibiotic use for long term and even the intake of too many raw egg whites kasi they contain avidin. So, nangyayari dyan guys, if you have B7 in the GI tract and you also have avidin, ang nangyayari, yung B7 mo sana, kaya siya ma-absorb readily by your enterocytes. Pero, the B7 is avidly conjugated to avidin. So, nangyayari, hindi mo siya ma-absorb sa iyong GI tract, leading to B7 or biotin deficiency. Okay? So, guys, always remember, mas nagkakos ng pellagra-like syndrome si B6. So, given in the exam, anong pipiliin mo? Choose B6 than B2 deficiency if pellagra-like. Pero pag-uusapan ay pellagra, of course, ang tamang sagot ay B3 or niacin. Now, dahil ang mga vitamin B ay mostly water-soluble, rare ang kanilang mga toxicities. So guys, konti lang sila. Take note lang. B6, toxicity, sensory neuropathy. B3, niacin, ang most serious ay hepatotoxicity. Okay, but the common ones involve facial flushing and of course podagra. Having a form of gout affecting the first MTP joint of your feet. Okay? Now for B9 and B12, they're also very important. Now, B9 is mainly absorbed in the jejunum. Pero ang ating B12 sa ating ileum. Kailangan mo dito muna ng ating IF. Okay, not intermittent fasting but rather intrinsic factor. Ang ating B9 saka B12 are both involved in methionine synthesis, mainly from homocysteine. Therefore, both of them will have an increase in homocysteine when they are deficient. Pero ang ating B12 is unique than B9 in terms of methyl malonyl coenzyme A transformation. Kasi kailangan siya para makagawa ka ng succinyl CoA. If you don't have B12, magkakaroon ka ng overstaying of your methyl malonic acid. Dadami siya in amount. Pero ang ating B9, wapakils kay methyl malonyl CoA. So normal lang ang kanyang amount dito. Okay? So as you can see guys, it's a form of differentiating B9 and B12 deficiency. Kasi both of them will have high homocysteine levels and low folic acid levels. Okay? So, kay B12 mataas si methyl malonic acid pero normal lang siya kay B9. And clinically, iba rin sila in terms of presentation. Both of them have reversible megaloblastic anemia. Pero si B12 ay merong irreversible na neuro problems, mostly posterior column degeneration. Now, you have to contrast this with your vitamin E deficiency. It also presents with posterior column demyelination pero meron siyang hemolytic anemia. Kasi meron kang problem with antioxidants when deficient. So, ang B12 natin is mostly nutritional anemia. Dahil konti ang yung B12, pangit ang maturation ng iyong RBCs. In contrast kay vitamin E, ang problema sa kanya ay antioxidant. So nagkakaroon ka ng hemolysis. So when I'll ask you, sino sa kanilang merong T-colored urine due to leakage of heme and hemoglobin from the RBC? Of course, it's your vitamin E deficiency. Kasi it leads to hemolysis or hemolytic pattern. So for the minerals, always remember guys, your two forms of iron. That is very important. Ferrous or Fe2+, and ferric or Fe3+. Fe3+, always think of two functions, transport and storage. Transport via transferrin, storage via apoferritin. Now, if apoferritin is conjugated to iron, nagiging kang ferritin molecule. The ferrous state of iron is the functional state. It's for oxygen binding. It's for enterocyte absorption. Siya yung form ng iron na kaya ma-absorb ng ating duodenal enterocyte. Okay, take note guys ha. Pag duodenum, ano ang ating mainly na na-absorb na substance that can also cause anemia when deficient? It's iron. Okay? Pag ang usapan ay jejunum, to ay B9. Pag ileum naman, it's your B12. Okay, klaro yan guys ha. And of course, it's also involved the ferrous iron form in the hydroxylation step of our collagen synthesis. Copper and zinc. Copper is mainly used for the enzymes hephastane, lysyl oxidase, okay, and your cytoplasmic SOD. The cytoplasm form or the non-mitochondrial form. So besides copper, kailangan din ang ating zinc for the functioning of this superoxide dismutase. Now, ang zinc natin is mainly for stabilization of the insulin structure and kailangan siya for normal spermatogenesis and fetal growth and development. But besides that, it's also an important micronutrient for the activation of your matrix metalloproteinases. These are enzymes used in the remodeling of connective tissue during wound healing. Zinc deficiency, think of acrodermatitis enteropathica. And copper deficiency, think of your Menkes disease. Now, oxidase enzymes require molybdenum for their activity. Okay? It's always molybdenum. Molybdenum, activation of oxidase enzymes. Manganese is a cofactor of numerous enzymes. Kung kanina, cytoplasmic SOD is copper and zinc, ang manganese is for mitochondrial SOD. Copper is a constituent of cobalamin. Diba? Ang cobalamin is B12. In B12 problems, magkakaroon ka ng macrocytic anemia. Therefore, if you have severe cobalt na kailangan para sa ating cobalamin, cobalt can also cause macrocytic anemia. Chromium is a potentiator of insulin action, but take note that zinc is the one that stabilizes the insulin structure. Fluoride is for the bone and teeth. In deficient amounts, it can cause dental caries, but in excess amounts, it can cause fluorosis. And your selenium, in deficient amounts, can lead to Kishan cardiomyopathy. Pero pag sobra na, can lead to your Kashkin-Beck disease. Now, for complex molecules, let's focus on your mucopolysaccharides. The mucopolysaccharide prominent in the skin, ano kaya dyan sa sagot? Keratin ba? Kasi keratin sa skin. Close but not enough. It's actually dermatan sulfate. Okay? Dito guys, para hindi malito, keratin, think of keratitis. And keratitis is what? It's the inflammation of the cornea. Therefore, keratin sulfate is for the cornea. Heparin is for the mast cells and basophils. And heparan sulfate is for the kidney basement membrane. Now, besides the location, always take note of the sugar units being combined to form your mucopolysaccharides. Okay, they're very testable in the PLE. So, the most abundant glycosaminoglycan in the body is chondroitin sulfate, not hyaluronic acid. Okay, it's a usual confusion. But hyaluronic acid is still unique. Kasi normally, GAGs are linked to form a proteoglycan. They're linked to a protein core. So for example, this is the protein core. Okay, think of it as the handle of a test tube brush. Okay, yung mga brush ng ating test tube brush, those are actually glycosaminoglycans. So glycosaminoglycans have a tendency to attach to protein cores to form proteoglycans, except for hyaluronic acid. Okay? Hayaan mo lang siya. Okay, hayaan mo lang ang hyaluronic acid. It has its own style. Okay? It does not depend on a protein core for its functioning. So, after your glycosaminoglycans, kailangan din ng ating mga phospholipids. The most abundant is your phosphatidylcholine. The reservoir of arachidonic acid is your phosphatidylinositol. And a marker of apoptosis is your phosphatidylserine. Usually kasi it's found in the inner leaflet of your cell membrane. But in times of apoptosis, it now goes to the outer leaflet of your cell membrane. Myelin sheath, you have your sphingomyelin. Eicosanoids. Eicosa means 20. Okay, kasi these are the different derivatives of our 20-carbon fatty acid, arachidonic acid, via two pathways, either lipoxygenase pathway or cyclooxygenase pathway. So, all of them are inflammatory in nature, except for your lipoxins. These are actually presenting with an anti-inflammatory effect. Thromboxane A2 is the natural vasoconstrictor of the body and a very strong platelet aggregator. Ang kanyang kalaban, karival ever since, is the prostacyclin, a natural vasodilator and the one that inhibits platelet aggregation. Leukotriene C4, D4, and E4 are associated with asthma. They are strong bronchospastic agents and they can cause increase in vascular permeability. Hindi nila kamag-anak si B4. Kasi B4, along with your prostaglandin D2, dito ka pumunta. They are chemotactic molecules. They attract inflammatory molecules to the site of inflammation. Now, we also need to have some review of your Expanded National Nutrition Survey, also known as your ENNS. So, the typical Filipino diet consists of a rice, vegetable, and fish. Guys, always think lang of an extra rice and a sinigang na bangus. Sarap, no? Sinigang na bangus tapos may rice. That is the typical Filipino diet. And guys, promise, it's a very testable concept. So don't forget it, okay? So some concepts by the ENNS. Most Filipinos consume at snack time. The preferred fuel is the LPG. Bottled or mineral water are the sources of drinking water. Iron is the most prevalent micronutrient deficiency in the Philippines. And deficiency in iron is the most common cause of anemia worldwide. The major cause of preventable mental retardation worldwide is iodine deficiency, and vitamin A deficiency is the leading cause of preventable blindness in children. So let's tackle some concepts in immunity, are very testable. So which is not an antigen-presenting cell. So ano ba ang galawan ng ating mga APCs or antigen-presenting cell? These are cells that manufacture a foreign body or a microbe into smaller antigens. Now these antigens are manufactured by the innate system, the macrophage perhaps, or any other phagocytic cell. Now, when they process the antigen, they present it to a member of the adaptive immunity. Okay, usually the T helper cell. Okay, so nangyari, na-activate biglang ating adaptive immunity. So, T cell is not an antigen-presenting cell. But the following dendritic cells, macrophages, B cells, and Langerhans cells of the skin are all antigen-presenting cells. But the major antigen-presenting cell of the body are your dendritic cells, okay? And therefore, they are responsible mainly for linking the innate immunity to the adaptive immunity. That's the main role of your dendritic cells. So what lymphocyte is part of the innate immunity? Most of the time kasi, they are part of adaptive immunity, except for the natural killer cells, which naturally kill virally infected cells and tumoral cells. So let's have a review of your white blood cells. Neutrophils are the most abundant cell in the peripheral blood, and they are the first cells attacking the inflammatory site for the first 6 to 24 hours. Lymphocytes are the second most predominant cell in the peripheral blood naman. Monocytes, which become macrophages, are the second line of defense. Lumalabas sila usually after the first 6 to 24 hours of inflammation. They're mostly related with chronic inflammation. Eosinophils are mainly for helmintic infections. Okay, they destroy these cells or these infections rather via major basic protein. Basophils are for allergic reactions, and they contain heparin, an anticoagulant, and histamine, a strong vasodilator. Now, may isa pang function na unique ang ating eosinophils. It's mainly for the clearance of your immune complexes or antigen-antibody complexes. And this is actually helpful kasi it can decrease the risk of having autoimmunity. Now, lymphocytes, we have three major categories here. T cells, B cells, and NK cells. T cells are the most abundant, and they're mainly for cellular immune response, such as cytotoxic T cells, helper T cells, and regulatory T cells. B cells are for the humoral immune response. So they use here their capability to become plasma cells because plasma cells release antibodies. And these antibodies serve as the humors of the adaptive immune response. NK cells, as mentioned, is part of the innate immunity. Okay? They destroy virally infected cells and tumoral cells via two mechanisms. First, a perforin granzyme mechanism. For example, this is the cell. The perforin perforates the cell and they put a bomb inside. That is the granzyme. Granzyme, para siyang granada. Okay, it's the first mechanism. Second, it's via your antibody-dependent cell-mediated cytotoxicity, also known as your ADCC. Now, ang T cells mo, marami din siyang types. We have your cytotoxic T cells. Para siyang NK cells, pero it only has the perforin granzyme mechanism. Wala siyang ADCC. Okay? We also have your regulatory T cells that suppresses the T cells to terminate inflammation. And of course, as mentioned, the plasma cells are derivatives of your B cells. Lastly, we have the complement system. These are a set of proteins that complement the innate immune system. They are activated via three pathways: classic, lectin, and alternate. But all of these pathways converge to the formation of a C3 convertase, eventually making different products afterwards. Now, these products serve as the function of your complement system for cell lysis, opsonization, and chemotaxis. As cell lysis, they make your membrane attack complex. Membrane attack complex. Basically, ang point niyan, gumagawa ng butas sa ating cell para siya ay mag-lyse. And involved here are C5b to C9. Opsonization, C3b. Ang ginagawa niyan ay pinapasarap nila ang mga microbes sa mata ng mga phagocytes. Pinapagawa silang yummy. So it means ini-increase ng ating opsonization ng ating phagocytosis. Chemotaxis naman is for an attraction. Pinapapunta dito sa isang part ng ating katawan sa site ng inflammation ng ating mga immune cells. So recall here guys, okay, may taxis sa C5 extension. Now, infection with this bacteria is increased among those with late complement deficiencies. The late complement deficiencies are your C5b to C9. So, if meron kang ganyang problem, you have an increased risk for Neisseria meningitidis and even in Neisseria gonorrhea. Okay? So, guys, remember, having late complement problems can pose a risk for Neisseria infections. Some pearls, pag early naman, it's mostly SLE. C2 is the most common deficiency worldwide in terms of complement proteins. C1 esterase inhibitor is associated with hereditary angioedema. Now, in PNH, ang problema dyan ay yung PIGA gene. This PIGA gene forms what we call a GPI anchor. This GPI anchor is found sa membrane ng ating RBC. Yan. Example, this is the GPI. The GPI holds two important substances: CD55 or decay accelerating factor and CD59 or your MIRL. So ginagawa nila, they are strong inhibitors of complement. So if they inhibit the complement system, hindi ka magkakaroon ng cell lysis of your RBC. Okay? Klaro. That's a normal situation. But in the absence of the PIGA gene, wala kang GPI. Therefore, hindi makaka-anchor ang CD55 sa CD59 mo kay RBC. Therefore, mawawala rin sila. Thus, pag nawala sila, you are now more prone for having cell lysis, leading to intravascular complement-mediated hemolysis. And as mentioned, if you have hemolysis, you have leakage of heme, can lead to hemoglobinuria, having a T-colored urine. And that is all for my biochemistry pearls for this season. Okay, I hope I was able to streamline to you the important concepts in biochemistry. Okay? So, guys, you're now needing the board exams. Okay? So, I hope nakatulong ako sa teacher to you guys for teaching you the salient points in biochemistry. Okay? But, at the end of the day, to be all your work. So, tread on, huwag matakot. Okay? Kayang-kaya niyan. Nakaka-anxiety naman talaga ang board exams. Pero masabi ko lang sa iyo is, ngayon ka pa ba sa suko? Malayo ka na. Malayo na narating mo. Okay? Alam kong malayo pa, pero always remember, malayo na ang napuntahan mo. Okay? So, good luck. Kayang-kaya mo yan. Tigasan mo lang ang loob mo. Okay? Paalam. So, see you on the other side.